Welcome to this deep dive. Today, we're tackling something really interesting, maybe even surprisingly common for some folks. Uh, Hodophobia. That's the intense fear of travel.
Yeah. And it's important to say right away, lots of people get a bit anxious about travel sometimes. Planning can be stressful, new places, all that stuff.
Sure, the usual worries.
But what we're digging into today is, well, it's a different beast entirely, much more intense, something that can really limit your life.
Exactly. We've been looking into the sources, and our mission here is really to get to grips with hodophobia. Like, what actually is it? How is it different from regular travel stress? And how do people deal with it?
Okay, so let's start with the
Yeah,
basics.
what's the definition?
Hodophobia is essentially an irrational, overwhelming fear of travel. And that word irrational is key.
Right.
Normal travel anxiety might be about, flight delays or getting lost. But with hodophobia, the fear itself is intense, persistent, and gets triggered just by thinking about travel or obviously during travel.
And it's not just preferring to stay home, is it? The sources we looked at were quite clear on that point.
Oh, absolutely. People with hodophobia actively avoid travel. They'll go to great lengths.
Hmm.
And this isn't just, oh, I fancy a staycation. The avoidance causes real distress, serious impairment in their lives. Think about jobs, seeing family, opportunities missed. It's very different from something called travel aversion.
Travel aversion.
Yeah, where
Yeah.
someone just finds travel, I don't know, inconvenient or maybe unpleasant, but it doesn't trigger that deep phobic reaction. Not the same thing at all.
Okay, got it. So the anxiety level is really high. What does that actually look like? What are the symptoms someone with hudophobia might experience?
Well, the core thing is that intense, persistent anxiety we mentioned. It bubbles up with just the thought of travel, or certainly when tried.
Persistent is the key word there, maybe.
Definitely. It's not a fleeting worry.
Hmm.
And for it to be, clinically called a phobia, this fear and anxiety pattern usually needs to be there for 6 months or more.
Wow, 6 months?
Yeah, that duration really tells you how embedded this fear can become. It's not just a bad week.
That makes sense. Now, travel itself is a big umbrella term. Does hodophobia often link up with other more specific fears?
It does, quite often.
Mm-hmm.
And looking at those helps understand the different angles.
Mm-hmm.
Things like fear of flying, obviously that's a big one.
Yeah.
Driving phobia too, or fear of trains. Thalassophobia, that's the fear of sea travel.
Okay.
And even agoraphobia, the fear of leaving safe places or situations where escape feels difficult. You can see how that would make any kind of travel seem terrifying, right?
Oh, absolutely. If leaving your safe zone is the core fear, travel is almost the definition of that challenge. Sounds like a complex web sometimes.
It can be.
So, what causes it? I mean, where does hodophobia actually come from psychologically? What's happening?
That's the big question, isn't it? And like with a lot of phobias, the sources suggest the causes and um, the things that keep it going are often complicated.
Not just one thing, usually.
Rarely one simple trigger, no. It's often a mix, maybe past negative experiences, things you've learned, perhaps even some kind of predisposition. It's usually multifaceted.
Okay, so if someone listening thinks, this sounds like me, how does diagnosis work? Is there like a test?
No, there's no blood test or scan or anything like that. The diagnosis is clinical.
Meaning?
A mental health professional talks to the person, evaluates their symptoms, asks about their history, and really looks at how much this fear of travel is messing up their life.
Right.
And one tricky thing, the sources point this out, is figuring out if hodophobia is the main problem, or if it's maybe a symptom of something broader, like generalized anxiety disorder, or maybe another phobia, like agoraphobia, is the root cause.
Ah, so it can be hard to pinpoint sometimes.
Exactly. But it is recognized. It's listed as a specific phobia in the DSM-5, the diagnostic manual professionals use.
Okay, so it's official, which must be validating for people going through it. So if someone does get diagnosed, what happens next? What are the options for managing it or, overcoming it?
Well, there are definitely effective approaches. For that immediate, acute anxiety, say you have to travel. Anti-anxiety medication can sometimes help in the short term just to manage the panic.
Like a temporary measure.
Yes. But for tackling the phobia itself, long-term, therapy is the main route. Exposure therapy comes up again and again as being really central.
Right.
And the evidence suggests it works even better when it's combined with cognitive behavioral therapy, CBT.
Okay, so exposure therapy, that's gradually facing the fear in safe steps, right?
Oh,
And CBT helps with the thought patterns.
you got it. Exposure therapy is very structured, starting small, maybe just thinking about travel, then looking at pictures, maybe planning a short trip, and building up slowly. And CBT helps you identify those negative, often irrational thoughts that fuel the fear. What if the plane crashes? What if I get lost and can't get back? And learn to challenge and change them.
So you tackle the behavior and the thoughts.
Exactly. And the sources also mention things like relaxation techniques, maybe deep breathing or mindfulness, and just learning more about anxiety psychoeducation can be useful additions to the main treatments.
Good to know there are solid, evidence-based ways to tackle it. Now, something really fascinating came up in the sources, kind of a historical twist.
Ah, yes. This was quite something. Sigmund Freud,
The Freud, father of psychoanalysis.
the very same. Apparently, in his letters, he admitted he suffered from a fear of travel. He used the German word Reisangst.
Wow. That's quite something. The guy who explored the depths of the unconscious mind was afraid to get on a train.
Kind of makes you pause, doesn't it? It suggests maybe even brilliant minds aren't immune to these sorts of anxieties. Perhaps highlights how powerful those unconscious drivers can be.
Yeah, and that intellectual understanding doesn't always translate to emotional control. But there was an important clarification in the source material about Freud's case, wasn't there?
Yes, absolutely crucial point. While he clearly had this travel anxiety, this Reisangst, the source explicitly says it wasn't considered a true phobia in the way we define hodophobia clinically today.
Okay, so it brings us back to that distinction.
Exactly, between general anxiety, even quite strong anxiety like Freud's,
Right.
and the specific diagnostic criteria for a phobia that intense avoidance and life impact. His wasn't quite that, apparently.
Right. Important difference. It shows there's a spectrum. Now, the sources also touch briefly on a couple of other travel-related issues just to differentiate them.
Yeah, just quickly to help define hodophobia by saying what it isn't, they mention things like, well, travel sickness, motion sickness, which is
Hmm.
purely physiological,
Okay.
and also something called transport tetany, which is apparently a stress reaction seen in animals during transport.
Ah, interesting.
So mentioning those just helps underline that hodophobia is a specific psychological condition, a phobia, not a physical reaction to motion or general animal stress.
Got it. Okay, so as we wrap up this deep dive, we've covered quite a bit of ground on hodophobia. What are the main things you think people should take away?
I think the key takeaways are hodophobia is a real, recognized fear of travel. It's irrational, intense, persistent,
Goes way beyond normal nerves.
way beyond. It leads to significant avoidance and distress. Diagnosis is clinical, and sometimes it's tricky to untangle from other anxiety issues.
Hmm.
But importantly, there are effective treatments, especially exposure therapy, usually with CBT, plus other helpful strategies.
And really stressing that difference again, common travel jitters versus a debilitating phobia that needs proper attention.
Absolutely vital distinction. One is just part of life sometimes. The other can really shrink your world.
Yeah.
And, thinking about how complex these phobias are, and even considering Freud's own struggles with Reisangst,
Hmm.
it leaves you, the listener, with a question, maybe. Well, travel is so common, often seen as desirable, right?
Yeah.
So what deeper psychological stuff might be going on that makes something like travel become the focus of such an intense, overwhelming fear for some people?
Hmm. That is definitely something to mull over. What makes something so everyday become so terrifying?
Exactly. Definitely some food for thought there.